Hello everyone and welcome back to another anatomy video. This is Dr. Ahmed from the Veterinary Anatomy channel. In this video we will continue talking about the anatomy of the heart of the sheep, and we will cover more the arteries and veins of the heart. So let's get started. Guys, in previous videos we talked in general about the anatomy of the heart and the different parts of it. Today we will start describing and dissecting the arteries and veins of the heart, or coming and leaving the heart, let's say, and we will start with the easiest one. For your information, we are looking at the auricular face. We learned previously why we name it as auricular face, because of the auricles here. We can see in this face the right ventricle located cranially, the left ventricle located caudally. From the right ventricle, guys, we have a very big artery, this one here. Can you see it? So later we will open and show you how it leaves, the ventricle. This artery called the pulmonary trunk. Pulmonary trunk. Why pulmonary trunk? We learned before that the right ventricle will push the blood toward the lung through the pulmonary trunk, and the pulmonary trunk at the level here will give two big arteries. I will show you. This is one. Will go to the left lung in this case, and in this case we will name it as the left pulmonary artery, and the other one will go to the right. I will show you in this video, like this one here. Can you see that? It's another artery going to the right lung, so this one is the right pulmonary artery. So again, the pulmonary trunk leaves the right ventricle to the lung and gives these two big arteries to the right and left lungs. From the left ventricle, there's a very important artery leaving the left ventricles. In the deeps there, we can find it there. Here is the aorta. So this here is the aorta. It comes from the left ventricle, and in this case we should remember the function of the left ventricle is to push the blood toward the whole body, to provide the body with oxygenated blood, of course. From the aorta leaves in the deeps there. We will open also the ventricle and show you how the aorta leaves the ventricle. So at the beginning, the aorta makes this curve here, and this curve will be named as the aortic arch. This is the aortic arch. The aorta gives some branches toward the head and forelimb and the neck, and after that moves inside the thoracic cavity backward here. Inside the thoracic cavity, we name the aorta as thoracic aorta. After that, it moves through the diaphragm to supply the organs inside the abdomen and pelvis and the hind limb, of course. And inside the abdomen, we will name the same aorta as abdominal aorta. So inside the thorax is the thoracic aorta. After moving through the diaphragm, we name it as abdominal aorta. Let's go through the branches from the aorta. So what we can see here is that this one is the first branch from the aorta, but this is not true. If you remember in the previous video, we said that there are two arteries leaving the aorta at the base there, called the coronary arteries, and they are responsible to supply the heart itself. So we can see one of them here in the dips. This one here, can you see it? This is the left coronary artery, the right is on the other side. They are the two first branches from the aorta. The second branch is this huge one here. Leaves and it moves a little bit cranially in cranial direction here, and gives several branches. The first two branches are the subclavian arteries. The subclavian arteries, I will put it just like this. So the first branch from, sorry, I didn't tell you the name of this big artery. So this big artery called the brachiocephalic trunk. The brachiocephalic trunk. Let's break down the name. Brachiocephalic. Brachio refers to brachium. Brachium refers to that region of the forelimb where we have the humerus. So that means this artery is responsible for the blood supply of the forelimbs. Brachio. Cephalic means head. That means this artery will also supply the neck and head. So that's why we name it as brachiocephalic trunk. Trunk because it gives several branches later. The first two branches from the brachiocephalic trunks are the subclavian arteries. Here to the left we have the left subclavian artery, which will give some branches inside the thoracic cavity. So we describe this artery in details in another video where the heart was intact inside the thoracic cavity. So watch that video if you want to know the different branches of the left subclavian artery. So the left subclavian artery gives several branches inside the thoracic cavity, and at the end it leaves the thoracic cavity toward the left forelimb. In this case, at that level we will name it as axillary artery and supplying the left forelimb. The same for the right subclavian artery. So this is the right subclavian artery here. It gives also another branches inside the thoracic cavity, and lastly it will go to the right forelimb. Here we have the right subclavian artery. After that, the brachiocephalic trunk moves after that, forming another small distance here called the bicarotid artery. The bicarotid artery. From the bicarotid artery we have two big arteries going toward the neck and finally to the head called the common carotid arteries. We have the left and the right common carotid arteries. Common carotid arteries, as I said before, it moves all the way to the head. On the way it supplies also the neck muscles, muscles found in the neck, all other structures in the neck, and finally it will go to the head, supply the organs in the head, the muscles of the head, and even the brain. Common carotid arteries. So this is the branches of the brachiocephalic trunk. We described the pulmonary trunk, and here we talked about the aorta. Now we can see that there is a structure moving just between them. Can you see that one? What is this? This one, guys, is very important, as it was a duct connecting the pulmonary trunk and the aorta before birth. A duct. Why? What was the function? Of course, let me just tell you that after birth, this duct will be closed and will be converted into a ligament called the ligamentum arteriosum, and there will be no function for it after birth. What was the function of this one before birth? Guys, before birth, we should remember that the lungs are not functional. Lungs are not functional before birth, and that's why there's no need to send blood from the right ventricle to the lung. And that's why pumping of the right ventricle will send the blood toward the pulmonary trunk, and from there, using this shortcut here, using this duct, the blood can go from the pulmonary trunk directly to the aorta, from there to the body. So, and in this case, we are bypassing the lungs. There is no need to send the blood to the lungs. Did you understand the function of this duct before birth? After birth, the lungs will start working, of course, and we need, of course, after birth to send the blood to the lung to get the oxygen from there. And that's why this duct will be closed and converted into a ligament in the way that the blood coming from the right ventricle through the pulmonary trunk has to go to the lungs. There's another, by the way, there's another mechanism to bypass the lungs before birth in the fetus, which is like a small opening between the left and the right atrium called the oval foramen. In this case, blood coming from the body through the caudal vena cava and the cranial vena cava to the right atrium. Let's go to that side there. So blood coming from the blood from the head and neck and forelimb here to the right atrium, the same through the caudal vena cava here. We will go directly through the oval foramen, which is located in the septum between the right atrium and the left atrium. So through this foramen, the blood can go from the right atrium directly to the left atrium, from the left atrium to the left ventricle, from the left ventricle to the aorta, bypassing the lungs. Or in this case, the blood which we receive in the right atrium will not, in this case, go to the right ventricle and from there to the pulmonary trunk. Okay? Did you get the idea? If there is some of the blood moving to the, the blood moves from the right atrium to the left atrium through the oval foramen. Some of the blood may go to the right ventricle, and from the right ventricle it will go to the pulmonary trunk. In this case, some blood can go through the duct we just described to the aorta, bypassing, the lungs again. Okay, it's very important topic. So we talked about the arteries. Let's move to the other side here and talk about the veins. It's very easy in this case. We don't have a lot of them. The two main veins collecting blood from the body and coming to the right atrium are the cranial vena cava. Cranial vena cava collect blood from the head, from the neck, and from the forelimbs, and push it to the right atrium. While the caudal vena cava, this big one here, it is actually the largest vein in the body here, collect blood from the caudal limb, from the pelvic cavity, from the abdominal cavity, and go through the diaphragm to the thorax cavity and transport this blood to the right atrium. Okay? In another videos, we described even the branches coming from the head, neck, and thorax and forelimbs to form the cranial vena cava. So make sure, if you want to learn more, make sure to watch that video there. Some other veins are here in the view. These veins here called the pulmonary veins. Pulmonary veins, they are veins coming from the lung. All of these veins, there are several veins here transporting the oxygenated blood from the lung to the left atrium, This is the left atrium here. This is the veins which we can see in this view. There is one more vein, very interesting to mention, this one here. This vein here. if you look at the vein, and it comes, I can tell you that it comes from the cow, the dorsal part of the thoracic cavity, collecting blood from partially from the abdomen and from the thoracic cavity there, and moves all the way in this curved direction to the right. Actually, it moves all the way here to the right atrium, this one called the azygos vein. The azygos vein. In this case, this is the left azygos vein. So in some animals we have both, the left and the right azygos veins. Just for your information, in the horse, there is no left azygos vein, there is only the right azygos vein. So this is missing in the horse. Dog, cat, it's the same actually. The left azygos vein is also missing, so they have only the right azygos vein. In ruminants, we have two scenarios. Sometimes there is only one, or let's say the first scenario is that the ruminant, they have both azygos veins, the left and the right one, and in some cases there is only one, but if there is only one, it will be the left azygos vein. Okay, I believe we will stop here a little bit. In the next video I will open all the cavities here inside the heart, including the big arteries, to show you very interesting structures, including the valves between the atria and the ventricles, and between the ventricles and the big arteries. Very important topic. So if you want to get some more information about this very interesting and important topic, so make sure to watch the next video. So before we leave, as agreed, I will give you some questions, For this, in this video, the first question will be, what is the name of this part here, this structure here? So what is the name of this structure here? Hint for you, we are looking at the auricular face of the heart. And remember why we name it as auricular face. So what is the name of this part here, this structure here? This is question number 1. In this view also, the question number 2 is, I would like you to write the name of this groove here. Yeah? This groove. And when I ask you the name, please write the exact, complete name of this groove. This is question number 2. And question number 3 will be, if we go to this side here, question number 3. Yeah, let's just go for this groove. So what is the name of this groove? Here? So we are looking at the atrial face. So what is the exact name of this groove? This is question number 3. Okay, that's everything, guys, for this video. Please make sure to subscribe, to share the video with your friends, and to write your answers in the comments. And if you have questions, please write them in the comments, so I will try my best to answer them. That's everything for today. Guys, just want to tell you that, according to the YouTube, actually 80% of the people watching these videos are not subscribers. So it will be very kind of you if you really share the video with your friends, and make sure to subscribe. See you in the next video. Bye bye for now.